Good morning, everybody. Can I thank the more than 58,000 people that came forward for testing in the last 24 hours? Even though it was a weekend, it was so pleasing to see those numbers. And can I please implore any of you with the mildest of symptoms or who've been asked to get a test, please do so. We need to keep those testing rates up, including in the next 24 hours, crucially in the days ahead, because that will give our health experts confidence that we're not missing any chains of community transmission. I foreshadowed a few days ago that the numbers were likely to bounce around, and that's what we've seen overnight. There were 35 cases of community transmission, although 24 of those were in isolation for the entire period. So pleasingly, whilst the numbers have gone up today, pleasingly 24 of those 35 were in isolation for that entire period. So health is obviously more concerned with the 7 cases that were in the community during their infectious period for the entire time that we understand they were infectious, and that's what health will be monitoring the next few days. I know everybody is keen to know what's going to happen beyond Friday's lockdown, as am I, but what I can tell you with certainty is that the next couple of days will be absolutely critical in allowing our health experts to collate the data that we've had in the last week and then to present their advice to government. I can say that the lockdown certainly has been effective in not doubling and tripling the figures that we were worried about. It's given our contact tracers the ability to maintain control over the virus. But what it has foreshadowed is that, unfortunately, when a small number of people do the wrong thing, it does result in extra cases. And I want to thank the vast majority of our citizens who've done absolutely the right thing. But unfortunately, having a party when you're not supposed to have a party is not doing the right thing. And we know, and Dr. Chant will comment, that some of the cases today are a result of issues or result of incidents where people have done the wrong thing. I do implore everybody to keep at it. Let's not give up. Let's make sure we're maintaining the rules that we've been asked to do. And again, as Dr. Chant has stressed on many occasions, outdoor settings are far less risky than indoor settings. If you feel you want to get out of your home because you are you've been locked up for so long, a walk around the block, a walk in your neighbourhood outdoors in the fresh air is the best way to provide that relief. Avoid shopping centres, avoid indoor settings. That's where the virus currently is transmitting, in addition to some workplaces, which Dr. Chant will talk about. So if you're a worker with the mildest of symptoms, please stay home and get tested, follow the health advice. And what we do appreciate is even when people have broken the rules, they're being very honest with health and letting us know your contacts, letting us know what's going on. Health maintains everybody's privacy. And please, if you are contacted for information, please be as open as you can, because that will determine what life looks like for us beyond Friday. I'll now ask Dr. Chant to give her update. Deputy Commissioner Warboys will give an update on compliance. And I do want to stress that police are increasing their activity in those areas where we know the virus is circulating. And we really look forward to the next few days to see what happens with the cases, especially those who've been obviously circulating in the community whilst infectious. And that's really what the health experts will look at. Those in isolation, we expect the case numbers of people in isolation to keep going up. We know how transmissible or how contagious the virus is. So if you live in the same household as someone or you're a close contact in isolation, yes, of course, we're worried about your health, but we also expect that you will develop the virus because of how contagious it is. But what we're really looking at is the number of people who've been still infectious in the community and what impact that will have in the next few days. So I'll ask Dr. Chant now to give her update, and then Deputy Commissioner Warboys.
Thank you, Premier. So New South Wales recorded those 35 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 33 cases are linked to a known case or cluster, and 20 of these are household contacts, again highlighting the risk within households. 2 cases are under investigation and 2 new cases were acquired overseas. We've had 58,373,000 tests reported to 8 p.m. last night, so that's, I think, going to be a record for a Sunday. It is important that we do not get fatigued with our testing. Please continue to get tested, and even if you've had a negative test, if your circumstances change and develop symptoms subsequently, please get retested. We're also calling on businesses to please support their workers to take time off and get tested, and actively really send that message that we as business owners will not want infectious people into our premises, and we're not going to look negatively at you if you turn up and ring in sick because you've got the mildest of symptoms at this critical time. We also have 4 people in ICU, none of whom are ventilated. Of today's 35 new cases, 24 were in isolation throughout their infectious period, and 4 cases were in isolation for part of their infectious period, again highlighting the importance of us getting to cases very soon, because even by the time we get to cases, often they've transmitted to their family, and their family might be in isolation for 1 day, but we need them in for that full infectious period. And 7 cases were infectious in the community. There are 2 new cases in residents of Summit Care Baulkham Hills Aged Care Facility, bringing the total number of cases associated with this facility to 5. Of the 2 new cases, both women in their 70s, one was a resident is fully vaccinated and one has not been vaccinated. And the resident who's not been vaccinated was entered Summit Care in mid-May. The 3 previously reported cases were fully vaccinated. Out of the abundance of caution, all of the 5 residents have been transferred to Westmead Hospital for observation, and an additional wife of one of the cases has also been transferred. There were 2 new cases associated with the birthday party at Hoxton Park, and this again highlights the fact of why we need those 14 days. We still are seeing cases get diagnosed and recognised through our surveillance testing, as some symptoms will be incredibly mild, or some people will be asymptomatic. So the importance of complying with those exit swabs and going through that clearance process is highlighted. We also need to say that, again, to highlight the Gold Coast to Sydney flight, VA524, we have 5 new cases on that flight. Now, it's been pleasing to see that when we've contacted those individuals, we had already identified them as close contacts, and they were isolating and therefore posed no other risk to the community. But my message is, even now we may continue to see cases arise from that plane. So again, don't think I've been in isolation for 7 days, I haven't had any cases. You've got to stay in there for that full 14 days and get those clearance swabs. In terms of Rose Bay Public School, we issued an alert that there was 1 new case to 8 p.m. last night, is a student at Rose Bay Public School. The case is a close contact of another previous case, and for the abundance of caution, we're not exactly sure about the full infectious period, but that person may have been infectious at school, and hence the usual process around investigations and calling the close contacts for the child's year group. In relation to, there was an event at 8 p.m. on Saturday the 26th of June at Meriton Suites Waterloo, a gathering, and we have 3 new cases linked to that. And we're going to be looking intensively at that event, and we'll provide some updated advice later today. We're just reviewing the results from extensive testing around those cases overnight. Just a message again to younger people, and can I thank the younger people again for playing their part in responding and helping us keep their loved ones safe and their close social network. It is important to remember that young people themselves can get sick and be hospitalised following COVID. So whilst it is that older people are going to be more likely to have severe outcomes from COVID, hospitalisation and deaths, I just want to remind young people that they too might be seriously impacted, and we have seen cases range from the 30s hospitalised and in ICU for a short period of time. In terms of construction sites, we're alerting people to the fact that there was some confirmed cases at a construction site in Cindy while potentially infectious. So 1 person worked at construction sites in Auburn and Tuangabi in Sydney's west. Anyone who worked at the construction site at 59A Street at Auburn from 11:30 a.m. to 2:30 p.m. between Monday the 28th of June until Friday the 2nd of July is a close contact and must immediately get tested and isolate for 14 days, regardless if they receive a negative result. Anyone who worked at the construction site at 74 Aurelia, Aurelia Street at Tuangabi from 7 a.m. to 12 p.m. between Monday the 28th of June until Friday the 2nd of July is a close contact and must immediately get tested and isolate for 14 days, regardless if you have a negative result. And if you worked at this Tuangabi site at any of these dates and at any time outside of the 7 a.m. to 12 p.m, you are considered a casual contact and must get tested immediately and isolate until you receive a negative test result. This again highlights that we do have essential activities continuing, and we do again urge everyone to be very vigilant for signs and symptoms, and I appreciate the cooperation of those workplaces. We were able to get line lists of people that worked at those workplaces, but just in case those records are inaccurate, we are making that public announcement. We are also asking the household contacts of those who attended these 3 construction sites to also immediately get tested and isolate until they receive a negative result. We're doing this because what we're trying to do is get ahead of the spread. Because some of these exposures date back to Monday the 28th of June, there's sufficient time for someone to become infectious and then passed on to the household. So we're asking that the household also isolate till we clear that the person who worked at the construction is negative. It allows us just to get ahead of any spread that might have occurred, because that exposure extends back to Monday the 28th of June. I'll leave it there. Thank you.
Thank you, Dr. Champ. Minister, Premier, good morning. 125 personal infringement notices were issued over the last 24 hours. Some of those were for people in shopping centres. We spoke about this over the last couple of days, that they were a place where people should be, particularly concerned about wearing a mask, and there were many people who chose not to do that, and they were reported and infringed by police. The other activity that we're sort of seeing a little bit more of is where police find that people are organising an event. One of these was where people travelled out of Bankstown yesterday to the Nunes area, which is in the Lithgow LGA, with a number of motorbikes and ATVs to spend time in that area, which was clearly contravening the public health order, and something that we would ask people to be particularly mindful when they're organising groups of friends and like-minded people, that they do comply with the public health order. And on this occasion, 17 people were issued infringement notices out of that event at Nunes, and those people were directed to return back to Bankstown in southwest Sydney. I'd also like to highlight the fact that over the weekend, with the particularly decent winter weather, that there were many people out exercising and doing their recreation, and police were very visible in those places, right from the city and outwards. This city has over 5 million people. There were plenty of people out. I heard plenty of comment around the number of people out. People need to understand that it's a real balance that police have to strike, and we will continue to do that in relation to the use of or the right of people to exercise and do their recreation, but against also the need for their mental well-being, their physical well-being, and also then balance that with the public health order. So when I talk about 125 personal infringement notices, when we look over the weekend, 5 million people out and about in Sydney doing their recreation, doing their exercise, I must say I think that Sydney did particularly well in terms of complying with the public health orders. It's a lot of people. Police are called to many jobs. Over the last 24 hours, just Sunday, over 1,000 calls to police around COVID-related business, more than half of those through Crime Stoppers. So certainly there are people that are reporting these offences, or they think are offences. Police are taking action. We're creating strong visibility throughout southwest Sydney, which we said we would do over the weekend. And I just ask people to stick with us. Police want to see people comply. It makes our job far easier, and we still have a little way to go. So please don't become complacent. The police won't become complacent. We are rostered right throughout the rest of this week and preparing for what might be ahead. So please, we just ask people to continue to be with us on this journey. Thank you.
On Saturday, 3 cases you've said have been linked to this Meriton Sweets event. Was it a party? How many people were there? Have you spoken to everyone that was there?
So at the moment, the Public Health Unit is following up with those individuals. We do believe it was a gathering at the Meriton Suites. What we're looking at is ascertaining and tracking down everyone who was at that event. What our focus is at the moment, we're really focused on locking any chains of transmission, hence why it is so critical that everyone continues to come forward and get tested. As we've done, you would expect us to do, we've done extensive testing around that facility. We'll update our public health advice, but we just want to ask the community to continue to come forward in testing and highlight how it is as we want to give the best information to the government to inform our response. We do need that community to continue to come forward for testing.
Based on the current trajectory, are you confident that we will exit lockdown at the end of the week as scheduled?
I'm making no comment until I've looked at all the data. Every day brings a new set of data and a new set of challenges, and what we think in the morning can change in the afternoon. I'm really pleased to see that we've had some people come forward for testing over the weekend, which has allowed us to link unlinked cases. And the more certainty we have that we have tracked down every single case of transmission, that really does provide us with a lot more confidence in advising government. So we need to make those links that have happened over the weekend, reassess and reanalyse the data, and that will be our focus today. But as I said, the situation can change. What is most important at the moment is for the community to continue to follow the public health advice, continue to wear masks in indoor environments, and continue to come out in testing in the large numbers they have. I don't think we've had a period of such high sustained testing. And we have got testing capacity. We've worked with our privates and our publics, and we've got that capacity. And we just need the community to continue to get tested, and also to use your networks. I mean, we will reach out to you, but we're also very pleased that as soon as a case is diagnosed, people are proactively reaching out into their social networks before we even finish the case interview with them to identify their contacts. So I'm really pleased that there is this strong partnership with the community as we work to track down any unrecognised chains of transmission.
Regarding are you talking dozens of people or just a handful?
No, we believe that there was a small group, and as I said, because obviously when you bring people together from different sites, putting the puzzle together takes a little bit of working through. So we're pleased that individuals have come forward to get tested, and that's my message. Please come forward to get tested. We're also pleased that people are often advising their close contacts through their social networks, even by the time we're getting to them, to tell them, you know, they've already got the call, you're positive, and they're immediately alerting their own close contacts, and we will obviously go through that formal process. But I just want to acknowledge the fact that that testing and finding all those cases is going to be so crucial.
In relation to Summer Care, is there concern, given the numbers of residents that we're now seeing positive, do we believe that they were all exposed by the initial staff members that tested positive there, or is there a chance that it is now spreading still within that aged care home?
The advice that we've got, and the team out in Western Sydney is working very closely with the facility and also the Commonwealth. So every day there are multiple connections to continually reassess the situation. Those concerns have not been raised. My understanding is the cases are arising in the area where we would expect the cases to occur, and that there's quite robust infection control measures put in place, and staff that may have been working at the time have been identified and put into that isolation for those 14 days, quarantine for 14 days.
Can you give assurance that the process is different? Obviously, you know, there's a lot of concern when there's an outbreak in an aged care home. Can you give an assurance that the processes are very different now, months later, than what we saw when Newmarch House happened?
I can assure that there's been an incredible amount of work. The Commonwealth has been working in aged care, and I think the fact that we've got high rates of vaccination in aged care amongst the residents was a really pleasing thing to see. When I heard about this and the vast majority of residents were vaccinated, that was a very positive outcome. We do know that the Commonwealth has been progressively vaccinating the aged care workforce, and I'd like to see that increased. But in terms of the response, we've had infection control experts from the district, we've had infectious disease experts, we've been working across plans supporting the facility, and the patients have been offered transfer, and all of them have accepted that, and we're pleased to support the home in any way we can. I know it is a very difficult time. I can only express my understanding to the families of people in that facility, but please, I'd like to assure them that we are that there is a lot of attention to doing everything we can to prevent any further transmission. But as you know, until we've passed that 14 days since those residents were last exposed to the infectious staff, we are not out of the woods. And so it is that daily testing where we will be generating new cases. What I'm also hopeful for is that those that are vaccinated have a very mild course. And there is some protection afforded by the vaccine.
Of the 4 people who are in ICU, do we know if any of them are vaccinated, and the remainder of people who are also being treated in hospital, are they all vaccinated?
We'll be reporting that in our weekly report, so we'll be happy to provide that information because I think the community is very interested to know. On the other side of it, just because you've been vaccinated doesn't mean you don't have to follow the public health advice. We have had some cases where people that are vaccinated can acquire the disease. So at the moment, it's not, changing our public health response. But for me, we know the 2 doses of the vaccine, both the Pfizer and the AstraZeneca, afford good protection against hospitalisation and death associated with exposure to COVID.
Dr. Chan, looking ahead to Monday, we're now less than a week away from term 3 perhaps starting. Can you go into detail about the sorts of things health officials are talking to education officials about, how school will look, and when you plan to make a call as to whether school will physically go back?
Just to be clear, I'll provide my advice through the government processes, but we've worked hand in glove with education right throughout this. We've engaged also with the independents and Catholic sectors. We'll be keeping them updated. Clearly, those decisions are yet to be made, but as a general sense, some of the things that we have looked at are things that we've had in place earlier. We try and minimise parents coming to drop off the schools. We try and prevent parent functions and gatherings on schools. We try and minimise mixing across school grades so that if you've got one case, you don't infect a broader group. All of those strategies that I think parents will have remembered from various points in the response are some of the strategies that have stood us in good stead, and I think they're the sort of things that would be informing policy thinking.
How soon, though, given how crucial going back to school is for work, for families, what's your deadline for making that call so people can make their arrangements?
As I said, we're monitoring the situation regularly. We'll provide regular updates to government, and government is considering and keeping a close eye on how the situation evolves. That's for another time. I think our focus at the moment is those key messages of getting everyone tested, please with the most minimal of symptoms. Please, I really want to say thank you to the cooperation of everyone. And I did have an email again last night, just to reinforce. I think you are aware that we do everything we can to protect the privacy of individuals. We only release information which is relevant for public health purposes. And I just would encourage everyone to have confidence in it. I'd also encourage people to just remember that even if you think I've got a cold or a stuff, but I'll just stay at home, you're missing one key point. Us not knowing you've got the disease means that we haven't got those missing links. We haven't got either the surety of where you fit in the trail, and you may well, someone else who's infected you may have actually infected lots of others, and so we missed that opportunity. So I just wanted to also explain to people that even if you think, oh, I'm unwell, I've got the cough, I'm not going to spread it to any others, you're missing a critical piece that we actually want to know you've got it, because that might actually help us find some other streams of transmission. So don't delay in getting testing, and don't just take that approach to
Dr. Brett, those school limits that you just mentioned, are you considering those for just Greater Sydney or all of New South Wales?
Again, too premature to comment. It's a matter for government.
Premier, can I ask about this comment that Dr. Dart made in relation to businesses supporting workers to call in sick? Should casual workers have some kind of support if they need to call in sick? And if they should, is that something the state government can provide, or is that a federal government? Should the federal government?
Can I say the issue has been, and we're very grateful that workplaces have respected the need for workers to stay home and get tested if they have the mildest of symptoms, and that's been working well. The onus is really on the individual. Your boss may not know that you have symptoms, and I'm sure your boss would want you to stay home and not infect the entire workplace, which would have to get shut down. So can I say that employers and businesses have been outstanding in relation to allowing their workers during work time to get tested and to stay home and isolate and all those things. But I just urge all of us to take responsibility. The onus is on us as individuals. Businesses have been supported through our grants in relation to what the current lockdown. But I just ask individuals to please take personal responsibility. By your own actions, you might be infecting your entire workplace and then shutting down your workplace. Your boss would much rather you went and got tested and stayed home rather than infect your workplace. And those provisions are there and everybody understands them. And I do want to thank everybody who's been responsible. But we have seen since the lockdown that people doing essential work in the community have done so, unfortunately, on a few occasions with symptoms. And that has caused some of the cases that we've seen in the last few days. So I just say to everybody, no matter your situation, if you have the mildest of symptoms, get tested, stay home until further health advice. And please just respect your loved ones, but also your workplace colleagues. And I just can't make that plea strongly enough.
Premier, just in regards to the flight cap that was announced by National Cabinet on Friday, could New South Wales go it alone and take on more vaccinated people?
Look, we have really carried the burden on behalf of the nation. More than half of all Australians that came back through Sydney Airport. In fact, New South Wales has processed thousands and thousands of citizens from other states. We've taken on that risk, and we did so on behalf of the nation, and we did so gladly, and that's why I was the lone voice in saying that I was disappointed in what happened, because it doesn't necessarily reduce the risk. What it does is it reduces the number of Australians coming back home, but it doesn't necessarily reduce the risk, because we know it only takes one error or one oversight or one issue for the virus to get out. So, but as a National Cabinet, that was the decision taken. But I also say that that New South Wales would consider exceptional circumstances where we did have a compassionate approach, but they're conversations I need to have with the Prime Minister. I'm sorry?
Just on vaccines, you mentioned last week there aren't enough GPs, you're worried that there aren't enough GPs being signed up. They are starting to deliver Pfizer today, but it is a smaller number than we were originally anticipating. Is this issue falling down, and will it mean a delay to simply the numbers you get?
Well, we have a chance now. We have a chance now between when the vaccines arrive to really increase our capacity. And the New South Wales government has done that by increasing our mass vaccination clinics, by increasing the sites where people can get the vaccine, by having really solid conversations with pharmacies, which will continue. But we don't have responsibility or can't control the number of GPs that are signed up and the number of doses they have. So I've been making that point at National Cabinet for a long time. I do feel that's being listened to, but as we know, the work has to happen now so that when the doses arrive, there's enough points of what we call points of access, enough places for people to go to get the vaccine.
Premier, do you think it's time to put teachers on the priority list for vaccines to make schools safer workplaces?
Oh, look, a number of teachers, I understand, have already been vaccinated, but all of us, any one of us in and around the community, have potential to spread the virus, and we have to be very clear about that. There is high risk amongst a number of categories of people, and I just say that as soon as we get those extra doses, of course, we'll continue to make sure that we provide the vaccine. But it's really important to note that there are many people who would like to get the vaccine that currently don't have access to it. The New South Wales government has expressed its frustration along the process, but what we have to do is work with what we have and make sure that we're doing our bit, as the Commonwealth is in relation to their responsibility in getting the vaccine out. And can I also make this point that we know what it takes to live in a COVID-safe world. We know what it takes. In the absence of the vaccine, we know what we need to do to keep the virus at bay. So all of us have to be COVID-safe. There aren't enough of us vaccinated to keep everybody safe. And just because you have the vaccine, when the rates of vaccination are only down to 6 or 7%, it doesn't protect anybody. So we just have to be mindful that until those rates of vaccination substantially increase, that it doesn't matter what job you have, all of us remain vulnerable. So long as we maintain the COVID safety rules, we'll be okay. And that's why it's important for everybody to do the right thing. Liz?
How disappointed are you in the NRL Dragons players having that gathering? And secondly, will Sydney be hosting Origin next week?
Oh, firstly, it's disappointing when anybody does the wrong thing. It doesn't matter what your profession is. It's just disappointing because every time somebody knowingly, and I say knowingly, does the wrong thing, it jeopardises all the rest of us. In relation to major events, including Origin, the New South Wales Government will be talking to all the relevant stakeholders about that.
Premier, just on the issue of schools next week, how soon will it be before parents know what is happening?
Look,
and what's your preference?
The New South Wales Government will assure the community that we will provide a certainty on the way forward, and we just need to wait for the experts to be in a position to be able to give us that definitive advice. And you'd expect us to already start planning, which we have. I can confirm my colleagues and I have started planning for various contingencies, and we're looking forward to receiving the health advice in the next few days. But we need to make sure that the data we rely on is current and that the risks we anticipate are fully considered to make the right decisions moving forward. But I am an eternal optimist, and I say to our community, please continue to do the right thing. Don't cut corners. We have heard examples, and again, Dr. Chand is way more polite than I am, but we have heard examples where people are having gatherings when they shouldn't. People are going to each other's houses when they shouldn't. Please do not do that. It is jeopardising everybody's ability to move forward. Can I just ask everybody to do the right thing? But please know that when you are identified as a positive case, health is very respectful of your privacy. We just need you to tell us the truth so that we can identify those venues and really stop the spread. And can I say this? I have insights most citizens don't have, and the biggest feeling people have when they're identified as being COVID positive is guilt. They may have passed it on to others. Don't underestimate the guilt anyone will feel if you unintentionally or intentionally, even worse, have symptoms and pass that on to those closest to you. Don't underestimate the guilt people feel, because I'm close enough to things to hear those examples. None of us want to be in a situation where we're giving the virus to those closest to us, and that's why it's really, really important for all of us to do the right thing.
Could you have done more to get aged care workers vaccinated here in New South Wales?
Well, we already offered our assistance. That was the responsibility of the Commonwealth, and we've already offered our assistance in that regard. And National Cabinet has made directions in that regard as well.
If New South Wales offered assistance to get aged care workers vaccinated, why are unvaccinated aged care workers still working in the system, Premier?
The bottom line is that New South Wales has made that offer. We asked the National Cabinet to give us advice on whether we could make it mandatory. National Cabinet has said mid-September is the deadline.
But has New South Wales been vaccinating aged
Yes,
care
we have.
workers?
We have been.
How many has New South Wales vaccinated?
The Minister for Health will have that update.
Sorry, James, just repeat the question.
How many aged care workers have been vaccinated by New South Wales Health under the state vaccine rollout? Mr. Hazzard.
Look, obviously aged care is the federal government's responsibility, and the federal government engaged a number of private companies to go and to vaccinate aged care residents. In the course of that, the federal government didn't prioritise at that point the staff in the aged care facilities. So what New South Wales Health did was to reach out through our 15 local health districts to each of the aged care facilities. In fact, I think the instructions was get to know your aged care facilities like they're your brothers and sisters. Get to know exactly the layout of the aged care facilities. This was months and months ago. And we also made very clear in that process that any aged care staff, albeit that they were federal responsibilities, could come forward and we would actually vaccinate them. So the only limitation really on that has been the supply of vaccine. And I have to say, that's been the single biggest constraint. I think, look, it's easy to be critical in hindsight, but the federal government, I think, did their best to try and get the vaccine when we really didn't know what vaccines would become available. Of course, the choice of AstraZeneca has had its challenges, and Pfizer supplies haven't been great. So, accepting that the federal government did their best at a difficult time to get as much vaccine as possible, I fear that we now have almost a sense of, it's almost a sense now of the Hunger Games, of people chasing vaccine, and until we get enough vaccine and enough GPs actually at the front line able to provide that vaccine into arms, we will continue to have effectively the Hunger Games going on here in New South Wales. So I think the focus should be at the moment, and the federal government appears to be doing this to try and roll out as much vaccine as they have available. They're doing their best to get more vaccine. I'd certainly like to see them now roll out and support GPs across the entire state of New South Wales. I think the GPs themselves have indicated that they would like to have more of their number actually able to vaccinate. And I think at some point we're going to have to go into a more normalised process of vaccine rollout. But until that time, those challenges remain. Liz.
What are your thoughts on some of these people who've been hosting parties and, doing the wrong thing during lockdown?
It's a delicate balance because, as Dr. Chant has indicated, we want individuals to feel like they can come forward when they do effectively get it wrong, and very wrong in some cases. But when you hear of parties going on in the middle of a lockdown, you've got to say, what is the thinking of some of these people? But as the Deputy Commissioner said, I'm also heartened by the fact that by far the majority of people are doing exactly what we would want them to be doing. I would say to those few people who are thinking that the rules are somehow not for them, that they're more entitled than the rest of us not to have to listen, well, no, you've actually got to listen, because you may be the people who actually spread this and keep us in lockdown for a lot longer than the rest of the community would like.
Minister, just on Minister, regards to businesses doing the wrong thing. We've had now the organic shop at Bowral, the proprietor arrested now on several occasions. Can you just go and shut that shop down, or other businesses?
It's the irony, isn't it, that they're more interested in keeping us healthy with healthy food, but quite happy to spread the virus. We're taking all steps. Police and health are working together, and there've been notices served on them, and further steps will be taken if they don't comply.
On aged care, Minister, New South Wales Health offered to vaccinate aged care staff because you were effectively didn't think the federal government was doing enough to get those staff vaccinated.
Well, we were there to help, James.
Yeah, so you were there to help. How many staff did New South Wales vaccinate?
Those staff that have come in, well, I can't give you that specific number at the moment, but certainly a lot of staff did come forward, and I think that's a positive, so we'll work with that. Thank you.
Should parents start making plans for next week, assuming that school won't go back?
You just want to keep asking that question of anybody who's prepared to give you an answer. I really thought the Premier's answer was very good, and I'll edit that. Thank you.
Premier, business groups have come out today, Premier, saying that it's really up to the states now to honour the 4-phase plan announced by National Cabinet on Friday. You estimated a few weeks ago that a vaccine threshold should be around 80%. If National Cabinet agrees on something lower, will you support that?
I'd be delighted. The figure I gave was 80% of adults. The figure that has been bandied around is including children, the whole population. So I'd be comfortable with whatever the experts decided. But I took the courageous step perhaps some time ago to say this is what New South Wales would think is a good target. 10 million jabs. We're at 2.4 million jabs already, and I want to thank every single person who's come forward to get vaccinated, and we're looking forward to the next few months. I mean, we have to get through the next few months, but once the additional vaccines arrive, I think it really really will change the conversation, and people will feel much more optimistic about the future when those doses get here, and we can't wait. But there's just the next few months we have to get through, which is why the next few days for New South Wales is very critical, and we ask everybody to do the right thing. I'm sorry, I didn't get the first
Sorry,
bit.
on eligibility, would you support, instead of a max vaccination target, everyone getting vaccinated at 80%, would you support 80% of the population is eligible for vaccination?
Oh, look, I'm okay with whatever the experts decide. But what I think the people of New South Wales and Australia want is a timeline and a target. And so I'm happy to support whatever the experts determine. But when I've sought the advice of our experts in New South Wales, and we've talked specifically about the adult population, we've said 80%. But if you include children, well, obviously that population goes down. So I'd be happy with whatever target the experts decide. But I think what is important is for the people of our state and our nation to have a sense of what the next few months, the next 6 months looks like. And I'm always happy to have that conversation. Thanks, everybody. Lastly, you've had a few goes, yeah.
I'm really sorry.
Yeah.
It requires a lot of unity from state.
So I didn't get the first bit of your question.
On the national plan, it requires a lot of unity from state and territory leaders. Do you have faith that they will be able to kind of form a united
Well,
front?
I have faith if everybody signs up to the timelines. I mean, I think what's really important is the concepts we put forward in the 4 phases are no-brainers. I mean, that's what New South Wales has been doing and saying for a long time. But it really comes down to what targets we're prepared to set and what the timelines are. And I think that's what our citizens want from us. But in the meantime, can I just urge everybody, whilst I've got the last say today, to please follow the rules. The next few days are critical. We want to get out of this lockdown as soon as possible in a timely way. And I just thank everybody for the efforts to date, but please keep at it. The next few days will be critical in our decision making. Thanks, everybody.
Thank you.